Okay. My name is Donna Campbell. For those of you who don't know me, I'm apparently known as a troublemaker around here. If you were in the NCVHS session, that's where you can gather some of it. I work for Healthcare Service Corporation, otherwise known as HCSC. I'm introducing Greg Garcia, who conveniently has the same acronyms in a different order. He's at HSCC. He's an executive director, cybersecurity working group for the HSCC, which is an industry consortium. It sounds like he's going to give you a little bit of information about it, and I'm going to let him take it away. Do you want this?
I'll just stand up here. All right, hello everybody. Oh good, more are coming in. This is like Halloween at my house. We never get any people knocking on the door, that I can give candy to, and I've got lots of candy to give you today. Thanks, Donna. Okay, so I'm gonna start with a question, and then get more into the meat of the matter. But my question is, what is your problem? It is funny, but it isn't. Your problem is our problem. And our problem is that data breaches across the health sector have more than doubled over the past 5 years. About 700 data breaches alone just last year, more than half of which came through third-party service providers and vendors, most of which were because of cyber attacks. 52 million records just last year. Our problem is ransomware attacks over the same period of time, almost 400. Last year alone, almost 100 ransomware attacks. Our problem is that those ransomware attacks result in canceled or rescheduled care to patients. They result in ambulance diversions. They result in EHRs going down for extended periods of time. Our problem is medical devices are often bought insecure out of the box. Cyber vulnerabilities out of the box. Our problem is that those medical devices often cannot be patched as they age in the clinical environment, making them more vulnerable to cyber attack. That is our problem. It's our problem collectively. And by collectively, this is who we represent in the Sector Coordinating Council. We are part of this interdependent, interconnected ecosystem. And you guys who are involved in health IT and electronic data exchange, you are the information circulatory system to this big morass called the healthcare system. So our problem is your problem is our problem about how we maintain a secure, available healthcare environment and all the information that goes with that. So before I go on, just so a word about me. How am I here? And I'll go into what the Sector Council is. I'm the Executive Director of the Cybersecurity Working Group of the overall Sector Coordinating Council. I'll explain that. My background is I'm not really a healthcare guy. I'm not an engineer, technician. I've spent my career at the intersection of policy, government, public policy, business, technology. Before this, I was with the Financial Services Sector Coordinating Council. And before that, I spent time developing the Information Technology Sector Council. In between, I was with the Department of Homeland Security. I was the nation's first Department of Homeland Security Assistant Secretary for Cybersecurity. I oversaw the national public-private partnership for critical infrastructure protection. Healthcare is critical infrastructure under law. And I spent a little bit of time writing law in the Congress as a congressional staffer. So, like that insurance commercial, I know a thing or two because I've seen a thing or two. I'm getting old, but that's how I come at this this mission. And this is, I think, all not news to you, but this is the ecosystem that we're dealing with and why information is so vulnerable. Every step of a patient's and a provider's and a payer's and a pharmaceutical pharmacy, every point along the value chain of that information flow. For me to go to the doctor and to get my prescription, and I go to CVS to fill it, and the payer knows about that. Everybody knows about my information. And it's all digitized now. And so this is both the promise and the fragility of our digitized electronic healthcare system. And some say it's neither healthcare nor a system, but this is what we have to deal with. Ooh, ooh, okay. So I already, riffed off of some of these data points, but this is just to sort of level set for you about the scope and the depth of the issues that we deal with in the Sector Coordinating Council and all of industry. This doesn't look much different from, name your sector. The electricity sector, man, they've got a lot of vulnerabilities. Financial services sector, well, they're putting hundreds of billions of dollars into protecting money. And they have that money to protect themselves with. They're pretty far along. Many other sectors suffer ransomware. We happen to be, how proud are we, the #1 target? Among all critical industry sectors, healthcare is the big cash cow for cyber criminals. And that cash cow is in this ransomware statistic. Because it's just easy money, it's easy pickings. If you're a cyber criminal, you know that hospital needs to A, treat patients, and B, stay in business in order to treat patients. So, well, they've probably got cyber insurance. We can get the money from them. 20 million easy dollars transmitted in Bitcoin over a platform, over a dark web platform. They'll get the money. FBI says, no, don't pay. Well, the hospital's going to have to make a choice. Do we stay in business if we pay? We go under if we don't, because we'll never get that data back. It's locked up, and the data is not available, scheduling is not available, reimbursement's not available, medical devices are down, they're turned into bricks. That's what a ransomware attack does. That kills the business. It kills your business, or at least severely damages it. So this is the existential problem this industry faces, and the costs here. There we are. We're the top. We're the top in terms of cost, and there's so many different numbers about what's the average cost of one data record when it's lost. Pick your survey, pick your statistic, but it's never a good number. And the same with medical devices. I think this comes from the American Hospital Association. Average hospital, 7,500 devices. Imagine having to say, you can only protect what you know you have. Well, just knowing what you have alone is a very hard thing to do. I've got my cell phone here, my smartphone. Well, that's connected to the hospital network. Who does the Chief Information Security Officer have an understanding of how my phone is connected to the network? I did that again. Okay. So, this is just sort of a very simplified, another way of profiling what the threat is and why we need to care. I'm not going to walk through all of this, but what we in the Health Sector Council recognize is that the cyber threats we face are, at #1, a patient safety issue. In fact, our organizing principle is Cyber safety is patient safety. But it's all the other points along the value chain is that it is an operational security issue. It becomes a financial issue. It becomes a legal regulatory compliance issue, becomes a reputational issue. So this is why we all need to be paying attention to this. Not just how to prepare against a cyber attack, and it does take some investment. And it's not if, but when we're going to get attacked. But then what do you do after the fact? What do you do right of boom? Right? Left of boom is prepare. Boom is the cyber attack. Right of boom is how do you restore operations? How resilient are you? We were just talking about one of our member organizations, very active, University of Vermont Healthcare, back in October, 3 years ago now, October of 2020. The lights went out. They had a ransomware attack that knocked out their email, their phones, all of their systems for 6 weeks. Imagine that, 6 weeks. How do you care for patients? How do you get reimbursed? How do you manage the public fallout, public perception? This is what we have to worry about. And then you get and then the marketing people say, God, we don't want to have these headlines about us. So, it is a scary world. So what are we doing about this? We are the Health Sector Coordinating Council. The Sector Coordinating Council is a generic term that refers to any one of the 17 government-designated critical industry sectors. Healthcare is in the same category as electricity, telecommunications, financial services, oil and gas, water, transportation, chemicals, emergency services, the list goes on. 17 critical sectors organized by the encouragement of this foundation of policies by the government, starting at the bottom there, Presidential Decision Directive 63, 1998. That was the first one that says, man, we got these critical industry sectors. They're under attack every day from hurricanes and wildfires and earthquakes, cyber attack, terrorism. These sectors are owned and operated primarily by private industry. So, it's not a mandate, but it is your responsibility. It is your national duty to organize as an industry sector around the mission of identifying and mitigating those systemic threats, and to do it with each other. So I showed you that ecosystem slide about the healthcare industry, and that means all of those subsectors of healthcare working together, identify and mitigate those threats together, but also with the government. So I said when I was with the Department of Homeland Security, I was the Assistant Secretary that was responsible for coordinating and overseeing the entire national public-private partnership between Department of Energy and Electricity, EPA and Water, Department of Treasury and the financial services sector, HHS, and the healthcare industry. How do you do that? How do you work together? Yes, we're regulated. Electricity is regulated, financial services is regulated, but that's not what the relationship is. The relationship is we understand something like cybersecurity, as complex and evolving as it is, you're not going to fix it with just regulations alone. Not going to happen. Nor can industry say, just leave us alone, we got this. No, you don't got this. You can't fix it by market forces alone either. So we're going to have to be a little bit more resilient, more resourceful, just the way the cyber criminals are. They're very, they're not always sophisticated, but they're resourceful. They're street thugs, but they're also, well-financed nation-state criminal groups for national purposes. So this is just, I think I've said this, the Health Sector Coordinating Council, this is our mission, this is what we are. we have a special designation. So we're here as part of WEDI. What distinguishes any sector coordinating council is we have a specially designated status as an advisory committee to the government, unlike any of the, for example, 50 trade associations that belong to the sector council, like WEDI, or AHA, or AdvaMed, the MedTech guys, AHIP, the plans and payers. We are what's called a CPAC. That's just this inside Washington stuff. But it basically says we're a critical infrastructure partnership advisory council as designated by the Department of Homeland Security. If you get together with the government on an ongoing basis, you meet with the government, you're decisioning, you're planning, you're coordinating. We are exempt from normal federal advisory committee rules that says you meet with the government, you got to allow the public to come to your meetings, and you have to let the public speak. Now, can you imagine when we're having these very sensitive threat, vulnerability, mitigation discussions about how are we a big target? What are our vulnerabilities? Do you think we're going to allow the public into that meeting? And who's in the public? Who's sitting in that audience? No, that has to be closed. So that's what gives us that necessary trusted environment, that trusted relationship with the government to deal with us in that collaborative way. So I'm the executive director of the Cybersecurity Working Group. No, this is our profile. I don't need to read it to you. When we do get together with the government, we have two in-person meetings per year, April and upcoming December, and a number of meetings during the week over Zoom or whatever. When we do that, we have to have a special little CPAC speech given by DHS. You are now entering the CPAC zone. Okay, got it. But then put the J in front of cybersecurity. That's when we are the joint cybersecurity working group with government. It's just a way for us to sort of institutionalize and memorialize our work as a joint effort. And I'm giving you all this because I would like you all to take this back, if this is not necessarily going to be in your wheelhouse, given your specific job responsibilities within your organizations, but your senior management needs to know about this if they're not already involved. We have a number of folks, Joe Pari, for example, they're all over as the sponsor. Great partner, they are a member of ours, as WEDI is a member of ours and other health IT organizations, Epic and Cerner and some of the big folks. But anyway, as an industry group, we do have to have a governance structure, a charter. This is part of our requirements as a CPAC, as a government partner. So we have an executive committee there representing all those different subsectors there. Executive committee is elected by the general membership, one organization, one vote. The executive committee, in turn, elects the chair and the vice chair. ExecCom has 3-year terms, chair, vice chair, 2-year terms. And then we have these active task groups, and that's where the action is. That's where all the work is happening, focused on the many different, sort of function-specific disciplines of cybersecurity that, if taken as a whole, it sort of starts to give you kind of a good, what does a good comprehensive cybersecurity risk management program look like? And so that's what those task groups are organized to do. Well, here's our esteemed leadership. We are currently chaired by Intermountain Healthcare in Salt Lake City. The CISO there, the CISO of Abbott, Chris Tyberg is our vice chair, and then this is the executive committee, all representing different subsectors. Because we have like 40% of our members are in the provider space. Mass General and McLaren, they control 2 seats. It's not control, but they occupy 2 seats because of their outsized representation. And then we have Health IT and the payers, represented by Primera, MedTech, cross-sector, public health, and pharma. And then an at-large member down there is Centura. Happens to be a provider, but it could be any subsector. And then we have as our government co-chairs FDA, Office of the CIO within HHS, which oversees the program that gives us our joint publications. You know, how easy is it for an industry group to do a joint publication with HHS where they've got their logo on it right next to ours? Not an easy thing to do. They've set up a process that said sometimes it's important that we both speak the same words to our stakeholders, we being industry and government. And so Julie Chua leads what's called the 405D program. That's a legislative, a statutory program, and then ASPR. And so this is just where the again the action is. Let me see, what's the next slide? Okay. When we reorganized back in 2018, we actually organized. We only had about 50 organizations then. Half of them were vendors who wanted to make a buck, and then I was hired to come and sort of bring it up to the level where it should be. We went from 50 to more than 400 now. But what are our objectives? What are we going to try to accomplish? What's the problem with healthcare cybersecurity? Well, we were fortunate to have been handed on a silver platter the results of a task force report, the Healthcare Industry Cyber Task Force, appointed by HHS at the direction of the Congress, 24 government and industry experts in healthcare and cybersecurity. They were told to answer 2 questions. Why is the healthcare industry getting slammed by cyber attacks so badly? Number 1. And number 2, what do we do about it? And, you know, they diagnosed that healthcare cyber is in critical condition. Ooh, okay, that's ominous. And they had a long list of recommendations for us and about what needs to be done. Medical device security, information sharing, better workforce, third-party risk management. And we thought, well, okay, that's great. We've got this agenda handed to us. Let's organize into a task group structure that we can really put meat on the bones of all of those recommendations and try to help the industry understand not just the what, but the how. And the how as expressed and experienced by the sector itself, some of the more sophisticated, resourced organizations in healthcare who have been through this and who have invested in it and who are sophisticated enough to be able to develop best practices and recommendations that are scalable from the smalls up to the bigs. You know, that small, you know, rural Louisiana clinic, you know, they're operating at break even on a good day, negative margins the next day. How are we going to tell them to, you know, invest in cybersecurity when they can't even find a nurse to hire? But anyway, this is how we have organized ourselves. Each one of these task groups is co-led by 3 individuals, 2 industry people from different subsectors. Because it's a cross-sector group, we need to have that varied perspective. When we talk about medical device security, well, who are the big stakeholders there? It's the medical device manufacturer and their customer, the hospital system. And they don't always like each other. Circular finger pointing, you know, you're responsible for cybersecurity. Nuh-uh, you are. And it goes around like that until we bring them together and say, nope, you got a shared problem here. You got a shared responsibility. You need to talk amongst yourselves and figure this out. And in that case, FDA is the 3rd chair on the government side, and their government support, CISA, HHS, NIST, I think, are participating as well as leads in these groups, and this is the output. So when I said, well, what are the best practices you need in cybersecurity? Starting in 2019, we released our first major work products, best practices. The one at the bottom on the right there was the big flagship one. It's called HICCUP. HICCUP, the Health Industry Cyber Practices. I came up with that name, and I love it every time I hear some sober government officials say the word hiccup. But this is the top 10 cybersecurity best practices that any healthcare system ought to be implementing. Volume 1, this is how it goes for the smalls. Volume 2, this is how it goes for mid and large organizations. Sometimes there's some investment involved. Sometimes it's pretty basic cyber hygiene stuff. Like train your people. Don't click on that attachment in the email because you're just letting them in. Don't do it. That doesn't cost a lot of money. Because that's where we're getting beat, is in some of that really basic stuff. But anyway, so all of these publications, you can go to that website, take it up to your management. This is all free. It's done by the sector for the sector, spoken in language that any healthcare organization that any one of these things is relevant to can actually understand and implement. One that I would really recommend, which was fun, we cannot charge dues as a federal advisory committee, so I'm actually a donation. We take donations. The Health ISAC, Information Sharing and Analysis Center, pays my salary, essentially to not work for them very much, to actually run the Sector Coordinating Council. But we take dues, and we take donations. We got contributions to pay a professional video production company so that we could do, remember I said cyber hygiene is one of the big problems. The clinicians. We did a cybersecurity for the clinicians video training series. You're a clinician, you're a medical student, you're a nurse, you're a surgeon, you're touching data, you're touching technology, you're touching patients every day. Like it or not, you've got some responsibility in cybersecurity. And what does that look like? So we recorded 8 videos, about 6 minutes each, 47 minutes in total, good for 1 CME, 1 CEU credit. The on-camera talent is an emergency room doc from UC San Diego, and he's a hacker as well, self-trained hacker. He can run circles around us, around our computers. He can hack the computer, and he can hack the human, literally. But look at that stuff. It's all available. It's a public service of the Sector Coordinating Council. And more coming up. The one on top there it's a joint product, operational continuity, cyber incident. You've just been hit, like University of Vermont, October 2020. They kind of wish they contributed to that OCCI, snarkily called Oxy. They contributed that heavily. They kind of wish they had this checklist when it hit the fan. Okay, you've been hit by a cyber attack, you're down, you're way down. You don't know when you're going to get back up online. What do you do? How do you maintain operations? How do you keep care of patients? Oxy, okay, so that's what that's about. And these others are coming. All of these might slip to Q1 next year. We're making sure that we get the best, the best product. Every task group that prepares something like this, it could take a year, 2 years, 2.5 or 3 years. All final drafts go up to the full cybersecurity working membership. That's almost 1,000 people representing those 400 some organizations. So everybody gets a chop at it, making sure we didn't miss anything, or we didn't say something stupid. But the intent is to make it as consensus as much as possible a document that it can be. Damn, I keep doing that. What's my timing? Donna, when do I have to stop? Okay, great. All right. Well, then I'm just about done. This is our big priority now. And I talked to Charles and Rob about this. So for 5 years, we've been pumping out content, just trying to give the industry a library of resources that they understand that's applicable to their environment about how to improve cybersecurity. Most of that stuff was centered around addressing that healthcare task force report, recommendations of 2017. Well, that was 2017. That was a snapshot in time. We all know the healthcare industry has changed an awful lot since 2017 to today, and it's going to change a hell of a lot more over the next 5 years. What does healthcare look like in 2029? So we, for the past year, have been working on this set of questions. What does, how is healthcare changing over these next 5 years? Well, hospital at home. I'm going to check into a hospital and they say, you got this, you've got this diabetes issue or kidney dialysis or something. We can send you home with a high-tech bed and we can provide service to you remotely. Ooh, that's interesting. You don't have to be in the brick and mortar hospital in this case. Wearables and implantables, artificial intelligence, telehealth, consumer healthcare on demand. Gosh, what does all that mean? What are the cybersecurity implications of those healthcare trends? And then what do we do about it? We being not just the healthcare sector writ large, but some of the key players. And it's not just the CISOs, it's not just the cybersecurity people. It's the CEOs, it's the C-suite, because they're the ones that direct resources. They are responsible for the overall risk profile, risk mitigation of their healthcare environment. But it's also about the clinicians, the frontline workers, and the nurses. So everyone has a piece of this. And remember, I said it's our problem. It's a shared problem. It's a shared responsibility. So we're going to be prescribing some high-level goals and then objectives to meet those goals, and then metrics, suggested metrics for how we know if those objectives, meaning what specific actions do we have to take as an industry as viewed through the prism of each individual enterprise. You all each need to know, your business model and how certain cybersecurity risk management investments can be applied in your environment. But the point is to be sure that we can measure performance and know that in 2029, as we are projecting the future of what healthcare looks like in 2029, we can say, we're not in critical condition anymore. We were in critical condition in 2017. We might still be in critical condition now. At least we have awareness. Back in 2017, the awareness was very low. But before I retire, I'd like to be called up to Capitol Hill and be asked the question, are we better off today than we were 5 years ago? And I said, Mr. Chairman, yes, we are. We're no longer in critical condition. We're in stable condition. And here's why. And here are the numbers to prove it. And so you all are part of that. And I've been talking with the WEDI folks as well, as how this organization is going to be a part of helping to drive that strategic plan, what we think the industry needs to do, out to your community, because this is your business, this is your risk, and it's all hands on deck. That our task in the Sector Coordinating Council, for all those other healthcare organizations that aren't paying attention to this big, hairy problem, our job is to lead that horse to water and to get that horse to drink. And the water is all of those best practices. If they were implemented, then we're going to start making progress. And that is our objective. So I hope all of you will join us in that. If your organization is not a member of the Sector Coordinating Council, you ought to be. Again, there are no dues to be paid. That is our requirement, our obligation as an advisory committee to the government, Sector Coordinating Council. If your organization meets the definition of what is a critical healthcare entity, basically it means you're regulated. Right? You're a covered entity or you're a business associate under HIPAA. You're regulated by FDA as a med tech or pharma. You're in the payment system. You're health IT under interoperability rules of ONC. You're a trade group representing any of the above. You can and should be a member of the Sector Coordinating Council. No cost to join, but if you choose to, the cost is sweat equity. So there's a lot of people like you who are experts in their particular area, all the way up to the CISO, who are by their organization donated in part to spend some part of their time to the work that we are collectively doing, so that you can help provide content or best practices on the front end, or on the back end when something is published. You can help promote it, evangelize it, be the ambassador and saying to all of your peer networks, this is our problem, it's your problem, it's our shared responsibility, let's get on it. So that's my takeaway for you. And look, we even have a QR code. So you can click on, capture that. You can get onto our LinkedIn page and support some of the work that we're putting out there. Go to our website. Everything that we have done is available on the website for your use. And if it's your business model, for you to monetize. We have a lot of consulting groups. We say the big guys from, Deloitte and I don't know, gosh, Sensinet and others. We say take that work, and if it works for in your special sauce for what you do with your clients, use our best practices. So it's all there for you. Nobody has an excuse not to step up. So I will stop there and pontificating. And any questions?
Yes, we can start with a softball from the online crowd. Is there an email list or some other mechanism we can use to sign up for alerts on new publications, releases, reports, et cetera?
Yes, so go to the website and contact us and ask for that. And that actually was a good suggestion from a reporter I talked to. He says, why don't you have just a distribution list? Maybe I don't want to join the sector council because maybe there's this expectation I have to do work. I just want to know what's going on. So in 2024, early next year, we're going to redesign our website, and it's going to include that. Click here if you just want to get our stuff. But for the time being, go to the website do the contact us, and we'll get you on our distribution list. When you join, you're put on the full cyber working group distribution list, and then when you join any of the task groups, there's a Google group for each one of those as well. So good question, thank you.
Great presentation. I know you guys are doing some phenomenal work. Let me add one more potential threat that is emerging. CMS regs now require health plans and providers to make available to patients PHI that goes directly to an app of their selection. What could possibly go wrong with that? Despite CMS's having their own blue button initiative that require any app that wants to connect to go through a minimum level of privacy and security, there's no requirement. It's the Wild West. And no patient ever reads terms and conditions before they hit I accept. Is that something on your radar screen?
Yes, and it's funny you mentioned that because I just had dinner last night with the University of Vermont CISO. He came down to do some Congressional Hill briefings and such. And he mentioned that very issue with some frustration that, yeah, it'd be great if, here I am a patient and this cool app is telling me, it can monitor all this stuff for me and I got to get MedStar to take it because they can build that into my patient data. But, that actually is not a very good app, is it? Full of holes. And he said, that's really, I don't want to put words in his mouth. I'll just paraphrase. It's annoying that they are forced as a provider to take that. And that was in the context of, so the White House has its, Office of the National Cyber Director, ONCD. A friend of mine is the former leader of that, Chris Inglis. He's retired, and Kemba Walden is coming up right now as the acting. They put out a request for information whenever, in the summer. And it was to the public, tell us all of those cybersecurity regulations you face that are conflicting, overlapping, that it may give security in this space, but simultaneously will cause lack of security in another space, unintended consequences. So that was Nate's answer to that question, those damn APIs. So, I think that's an issue that should be brought to ONCD to say, okay, here's an aberration in if ONCD, the National Cyber Director, or HHS or CISO is concerned about where are the gaps in cybersecurity where one set of stakeholders are subject to cybersecurity rules, but the others, like these Wild West app developers, are not subject to it. Or just other, all those other guys who, okay, I've got my Garmin watch on, got its heart rate and all kinds of cool stuff. What do they do with that information? They're not regulated under HIPAA. So how do we make sure that we plug some of those holes? So yes, man, that fits right in, that an organization is forced to do something that either will compromise their security or force them to invest more than they ordinarily would to plug that gap.
Thank you, Greg Ware.
Oh.
And it sounds like a great resource here. Is your website secure? Just kidding. No, just kidding. So,
Actually, it's provided by the Health ISAC, the Information Sharing and Analysis Center. It darn well better be. I'm not the guy to test that, but go ahead, give it a try, and see if you can mess with it. But anyway, go ahead.
so a lot of your publications and what you've been talking about is industry facing, where it's downstream. You're doing best practices. What's the vehicle? Because I saw you had a bullet there on how you advise the government.
Oh, yeah.
What's the vehicle for that? Is that congressional reports? Is that regulatory? Are you talking through Homeland Security?
Yeah.
Is it White House? Like, what's the vehicle?
It's sort of all of the above. So the strategic plan, I think, is going to say a fair amount about that, whether or not the government is going to agree with all of our recommendations as to what they ought to do. I think directionally they're going to say, yeah, got it. I know we need to do this. Some of it's Congress, like give HHS more authorities and more appropriations. That doesn't mean necessarily more regulation. What's CISA's role in this? CISA is supposed to be coordinating across all of the government agencies on cybersecurity for critical infrastructure. How do they help HHS? How do they help Treasury? How do they help Department of Energy? But there's an interesting development. I'm coming up on time. Do expect next year, we're going to see some movements from HHS. I can't be specific, partly because I don't know all the specifics. But they are under pressure to do more in terms of minimum cybersecurity controls, particularly on health providers. So I guess you could expect a proposed rulemaking. Okay, well, what does that look like? We hope it's going to look like, I mentioned HICCUP, top 10 cybersecurity controls for health systems. Let's start there. That's a joint industry government publication. And so as we worked with them through that and said, let's look at, HICCUP, if you're going to regulate, wink, wink, nudge, nudge, because many of us don't want regulation, particularly for the smalls who can't afford it. You can just go put that extra straw on the camel's back and down it goes. But we added to that, you said, the government recommendation. So look, if you're going to regulate industry, what are you going to do, government? You can tell us what to do, but what are you going to do? How relevant are you to this? Is there grant money for the smalls? You tell them to do something, well, show me the money. I can't do it. I'm at negative margins already. Well, what about incentives or subsidies? Can you give me some technical assistance? What other kinds of programs can government offer to providers to be sure they come up to snuff? outside of regulation in addition to regulation. So we have among those publications recommendations to the government as to what they can do. And they're kind of notional. And we worked with HHS through that, and they said, yep, got it, yep, we're thinking about that one, yep. And again, some of that comes back to the Congress, because HHS can only do so much with whatever funding slush fund they might have to redirect monies over to cyber. So, like, Congress, step up.
One more question from over here.
Hi, hopefully a simple one. There's numerous.
Yeah, but you don't get a simple answer.
Well, either a simple answer or no answer at all.
Okay.
I think that's where we're going. There's numerous references to 405D in here. Do you know if that's a code of federal regulations?
No. 405D is, maybe it is, but 405D is Section 405D of the Cybersecurity Act of 2015. All it said was, hey, HHS, Section 405C created the healthcare task force that I talked to you about. 405D said, and then HHS, you need to work with industry to develop consensus, voluntary best practices for healthcare cybersecurity. Okay. And so HHS took that and said, okay, what do we do with this thing? Okay, hey, Office of the CIO, you got this. And then they built the program that enables us in select cases to say, this is a best practice that's important enough that it should be co-branded by the sector coordinator, by industry and government and HHS, without it being a regulatory requirement. It's just notionally, this is what you ought to be doing.
But eventually, it probably will be a regulatory requirement. This is just.
Which is what I just
this is
referred
just-
to the, yeah.
Right, so this is just directing everybody to start coming up with some kind of standard.
Yes, but one more thing I'll add to that, and I know it at time. 405, what we produced, the HICCUP, Health Industry Cyber Practices, subsequently became recognized in law in 2021, January 5th, 21, before that fateful day. President signed into law a provision, an amendment to the High-Tech Act, and it said, hey, OCR, whenever a breached entity gets whacked, and if they can prove that they have, over the past year, implemented the NIST cybersecurity framework or HICCUP, they put into law HICCUP. There it is in statute, my HICCUP. If you've implemented that over the past year, then OCR, take it easy on them, because they did the right thing. So you still have to do your duty as OCR, you have to do an audit, you got regulatory fines, but take it easy on them, because otherwise you're just punishing the victim. They did the right thing, they invested, they still got whacked, and that's in law now. That's a good incentive for investment. Okay, I'm getting the hook.
Well, yeah, I think there's some people outside waiting to get in, or they want to shake your hand, because I think you're a superstar with some of those acronyms.
You didn't have acronyms back in
We got
the
acronyms.
X12
We got
and-
acronyms.
Sure.
We need a library for our acronyms. So I want to thank you, Greg. This concludes this session, and I hope you guys enjoyed it. I know I did. Thank you.